Hello, everyone. Welcome back to Second Opinion with Dr. Dua Hassan. Dua is a physician at the Boston Children's Hospital and a former instructor at the Stanford University School of Medicine. And today we're going to continue our after birth series with the newborn screen. Dua, tell me about the newborn screen.
Well, James, as you probably already know from having 3 children of your own, after you have a baby, about 24 hours after, the nurse will take your baby away and then make a small prick in the heel of the baby and put a few drops of your baby's precious blood on a card that gets sent off to the state lab. And I thought it would be worth it today to talk a little bit about why we do that test.
Yes, I would love to know why we do that test.
So the newborn screen basically tests for a few rare but serious genetic and metabolic conditions. And these are conditions that can cause severe disability, maybe even death if they're not caught and treated early.
Yes.
And as I've already said, it's a screen. So it's not a diagnosis, but it's sort of like a first pass screening tool in order for us to flag the babies who are potentially at risk for one of these conditions.
And that makes sense. Which conditions are included in the screen?
So there's about 25 or so core conditions that are basically universal amongst all the states. And then each state can add more conditions to screen. So there's maybe another 20 or 30 that might differ based on where you're living. But some of the universal diseases that are screened for are ones that a lot of people have probably heard of before. So one is sickle cell disease, which is a problem with hemoglobin and the red blood cells, a disease that is very prevalent in the US. And so we screen for that. Another is cystic fibrosis, which is a genetic condition that causes problems with our lungs. And then there's other conditions like hypothyroidism, which is something that people are probably familiar with in the adult patients, but in pediatrics patients, especially in babies, it can cause severe intellectual disability because thyroid hormone is critical for brain development.
And how did the list or the set of things that are screened for, how did that come to be?
Yeah, that's a great question. So initially, the newborn screen was developed around a disease called PKU. And PKU is a metabolic condition. The conditions I mentioned earlier, cystic fibrosis, sickle cell disease, those are genetic conditions. But there are another set of conditions that are critical to the way our bodies process proteins. And so those are a set of conditions called metabolic conditions. And it's also the reason why we do the newborn screen at about 24 hours of life, one of the reasons. We don't want to wait too long to do the newborn screen because one of the issues with the metabolic conditions is that when they accumulate in our bodies at high rates, they can cause brain damage. So we want to screen the babies early, but we don't want to screen them right when they're born because we want to make sure they've had a chance to feed so that if they do have a metabolic condition, these negative metabolites can build up in the body where we would get like an accurate screening. And so initially the concept of the newborn screen was started by individual named Robert Guthrie, and he had a niece who had PKU who ended up getting severe disability because we didn't have an ability to diagnose her early. And so he went around, I believe he was from upstate New York, I think it was Buffalo. He went around and essentially asked all of his neighbors if he could prick their baby's heel and sort of developed this test using literally the local babies where he was living and found that essentially there's a specific bacteria that feeds off of PKU, the metabolite that builds up in the body. If your baby had PKU, then it would screen positive with this bacteria. And so that was the very first condition that we started screening babies for. And then over time, as we developed other tools to screen for other conditions, we add those conditions onto the newborn screen.
Wow. What was the name of the person who did this again?
Robert Guthrie.
Guthrie. That's fantastic. And then, yeah, once you're already pricking the baby, you might as well add I guess we add whatever tests can be found in the blood. Is that how it works?
Yeah, and also different conditions that we already knew that infants and babies were at risk for. So one of the conditions that I mentioned earlier, cystic fibrosis, is something that we knew that some babies were born with. There was an old saying in Europe, "Go to the baby that tastes salty," because it used to be the case that doctors and nurses would taste the babies. They would lick the babies or kiss the babies. And if the baby was salty, they knew something was wrong with the baby. Because of the physiology of cystic fibrosis, one of the findings you find is very, very salty skin. Another metabolic condition, maple syrup urine disease, gets its name because the urine smelled and tasted a little bit like maple syrup. And so doctors would either smell the urine or taste the urine. And in fact, tasting urine of babies was a common practice That's where the name of diabetes comes from. Diabetes mellitus. Mellitus means sweet because people used to taste the urine, and if it tasted sweet, it meant that someone had diabetes. And so because of the newborn screen, we no longer need to lick babies or taste their urine. We can actually just use the newborn screen to sort of diagnose them.
Who, you may not know the answer to this, but who was actually doing this tasting? Was there a doctor that was like, you're,
Yeah, I mean, I'm being a little bit silly or facetious here because with CF, there is a sweat chloride test that was developed
yeah,
in the 60s, but
okay.
certainly historically in the 1800s, early 1900s, that these were very, and earlier than that, this was very routine to do those things.
That's fantastic. So all of that has now been collapsed into the newborn screen. Do we have a sense for
Yes.
how many children test positive for something on the screen? Or how common are these things that
Yeah, that is a great question. And that is one of the things that people should know about the newborn screen. And
Mm,
this is why at the beginning, I really emphasize the word screen,
mm,
because our goal in the newborn screen is to flag as many people who could possibly
mm,
have one of these conditions as possible. And so,
mm,
depending on the study you look at, it could be, you know, 50 babies screened positive, and only one of them, so 49 of them are false positives,
mm.
up to 100 babies screening positive and 99 of them being false positives. So the rate of false positivity, if you will, is pretty high. Depending on the study you look at, it's as high as 90 to 95%.
Wow.
And that's an intentional decision that has been
Mm,
made in order to essentially try to have as large of a bucket of people as possible to make sure we don't miss anyone. And
mm,
so it's really a first pass screening tool. So
mm.
your pricks the blood of your baby, it goes off to the state lab, and then your pediatrician is notified, usually within the first week of life, and then from that they do secondary testing. So if you are a mother or a father or a family member who finds out that their baby's screened positive for the newborn screen, I would not start worrying. I would not start freaking out. I would caution those people and make sure they understand that the vast majority of babies that screen positive, in fact, do not have any of these conditions.
Totally makes sense. Do we do any other regular screens like this? Is this because so I mean I know about this from my kids, but are there other places where we systematically draw blood like at a certain point in time to test for things like this?
This is probably one of the best and maybe the only one that I can think of that's like this, in part
Yes.
because it's universal,
Yeah.
it's essentially free, and it's highly regulated by
Yeah.
state labs. So it's really, I think, probably the only thing I can think of that has this model here in the United States.
Super cool. Anything else that we should know about it?
I think the only other thing to say is it causes, I've seen the nurses usually prick the babies, but I'm often in the room and I can say it is one of the least painful maneuvers that I generally see for babies. Sometimes, because it's capillary blood, so it's like a pinprick. Sometimes for babies, their capillaries aren't as robust as ours. And so
Mm,
the nurses kind of have to squeeze on the foot a little bit.
mhm.
But it's very well tolerated and not a particularly invasive or painful procedure, especially given all of the useful information we get from it.
Yeah. I remember being annoyed by the newborn screen for our second, not because of the pinprick, but just because we had finally gotten him to sleep and had a moment of rest. And then somebody came back in the room and I'm like, no, I was going to actually get to take a nap.
Yeah.
But
And that's very understandable. And that's also, like I said, really important that it's done around 24 hours for the reasons I stated earlier. That's why they're kind of sticklers, let's say, for the time.
yeah. Well, absolutely worth it. Look, there's no way to get through being a parent without getting woken up sometimes. So, we'll make it. Well, thanks for talking us through that and excited to continue our first day, excited to continue our beginning of life series here. And we'll talk to you again soon.